about some of them that are common in children. Let's start with flat foot. Okay. What is that?
Flat foot is a deformity in either way children or adults, where the sole of the foot steps on the ground. So you don't find that arc. Yeah. So there's that arc that is missing. That is why it's a flat foot. There is a collapse in the arc. Yeah.
So that means that that normal, do I call it a C? Some arc that everyone has at their foot, it is not there.
It's not there.
It is there in children. This is a condition you could find in children and also in adults.
Mostly in children, and mostly from 5 years and above. That is where it turns to be a risk. Below 5 years, maybe it can develop with time. And then in adulthood, you still find some adults who are not managed. Yeah.
And what would cause flat foot? Why would someone have a leg without the normal arc that we know?
It comes about when there is that collapse of the transverse arc. That is when you find someone with that flat foot. So mostly in children, you find that some of them are just born that way, but at some time you find some developing, and then others just remain like that. Yeah.
So it just develops that, like right now, I have my arc, so I could just look and it's not there.
It's not easy. You wake up and find it's not there. It's an abnormality that starts from childhood. Yeah.
Oh, so
and mostly you find in adults it was not discovered. Yeah.
So they realize it much later in life.
Yeah.
Is this deformity painful? When somebody does not have that arc, are they going to have pain?
Yeah, it's painful at some point because you find that that arc has an importance in the body. It's for shock absorbing the ground. So if you don't have that arc, you will find that you'll strain some muscle, you'll strain some tendons, you'll strain some I mean the ligaments there, there must be that strain, and especially at the ankle joint. So you'll find there's a swelling and there's that pain. Yeah.
And so when somebody has this condition, can it be rectified?
Yeah, it's very much rectified in childhood, but in adulthood we just do some support. You just support, yeah, for the sake of the pain. But in childhood, it's well managed. Yeah.
How do we rectify it? How does treatment of such a deformity involve? What is it going to involve?
You can do it using an arc support. There's that insole. Yeah. You put inside the shoe. It will develop with time. Yeah.
And does therapy help with this condition?
To some extent. Yeah.
And in this case, what exactly would therapy mean in such a condition?
Okay, the occupational therapists, the physiotherapists do some kind of good job there, but mostly the insole,
is what is going to help.
It helps the most, and then you get a very good boot shoe, and then you insert it there. Yeah.
So when you're talking about the sole, somebody might wonder, what kind of a sole?
Okay.
So what is this sole that you're saying that mostly it's the sole that is going to help with dealing in this condition?
So I think I came with a model.
Yeah. It's okay, you can show us.
So this is the arc support. Yeah. So you can see it has an arc here. This sole has that kind of an arc. So see, it shapes the leg just the way it is. So it's C-shaped. So once you insert it inside the shoe, and then once you put the shoe on, it forms that. Yeah. Yeah.
Also, it's going to help push the foot upwards, forming the curve that should have been there.
Yeah.
And so, is there any medication that somebody might use while they're trying to rectify this condition?
Maybe painkillers for people with pain. Yeah.
And is it weight? Is weight a concern when you're talking about flat foot? Is it a risk factor or something that could increase one's chances of developing this deformity?
It is a risk factor.
Yeah. How so?
Because in adulthood, you find these people cannot go for long distances. They can't walk for long distances. They keep on complaining their painful ankle joints. And to some extent, you find these people develop some kind of deformities. Yeah. It's traineas. It can cause some other issues like, you see the swollen ankle joints. So there's a risk there.
When
So,
somebody has
yeah, and we normally advise people to get it treated at an early age. Yeah, at the age of 5 years. Yeah, it's okay. Though we still do for the 2 years, 3 years. The earlier the better. Yeah.
That is okay. And are there some home remedies? You mentioned that there is a possibility that these might have started from childhood, but you only realize it later in life when you're an adult or with advanced age, like you're not 5, but you realize you have this. And because you mentioned that it is difficult to rectify it in adults, you only manage. Are there some home remedies that you could advise these people to make them more comfortable even as they live with this deformity?
The best thing is to avoid high-heeled shoes with this deformity. Yeah, and again, very flat shoes. So at least a shoe that's some kind of like a small heel, so that you get raised a bit. And again, not a very big high heel. And sport shoes are also good. You find some of these sport shoes at adulthood, especially the Mtumba shoes, sometimes they have that kind of an arc inside. Nowadays, they are making shoes with that. I think it's becoming a common issue. So once they are manufacturing shoes, you find that they have that kind sole inside that is rectified.
Just like the one you were showing.
Yeah, just like this one. Yeah. And again, now, someone now maybe has to be on painkillers here and there. Yeah.
Okay, so another of those deformities that you deal with is club foot.
Yeah.
So what is club foot, and whom are we most likely to find living with such a deformity?
Club foot is a deformity mostly in children, though still you'll find it in adults, those who are not rectified, where you find that the foot turns inwards. Yeah, and they're just like this. That is what we call club foot.
The foot are facing each
other.
other.
The foot are facing each other, they turn inwards. Yeah.
And what would be a cause for that?
It's congenital. Yeah.
By congenital, you mean?
Congenital means that someone was born that way. Yeah.
Also, it's not possible to develop that later in life. It's only in children.
Okay, mostly in children. You find those with some conditions like spina bifida. They tend to have it. Yeah.
And can this condition be rectified, or will this child have to bear with it all their life?
It's easily managed through seriocasting, something we call seriocasting. Seriocasting is where you put plaster. Either way, both feet. Yeah. And we use something we call the Pilani sheet method, the Pilani score. So it's a process. It's not a one-time thing. Until you come to the facility, you have that plaster put, and then you go home, and it's no, you have to follow some kind of a procedure. Like you come today, there's that thing we use, like you say, we score. There's that scoring we do. So today we find that we're at this point. Then you come another visit, we find that we are at this point. So by the end of the day, you will find that you have rectified. And then there's something else we use. Once you move out of the plaster being, so you understand the plaster.
Yeah, ni kama ile mtu akivunjika mguu.
Yes, we use that one. So once you find that you have scored something, we call it scoring. We use something we call the abduction brace. That's a brace that has some kind of a tumor that is used mostly 23 hours. So that means that child has to pumzika for 1 hour. And then you just move on. You find at some point, maybe you can advise them to just use it at night. And then at some point, you find that it is rectified. And if it's not rectified, because it comes as a result of something we call the Achilles tendon, it's short. So that is why you find that they have that club foot. So if it's not rectified, then you have to see a surgeon. Yeah,
it can be rectified with surgery.
If the Achilles tendon is very tight, it's rigid, so that means even the POP may not work on that child. So at that point, we call the surgeon to come and release that Achilles tendon. Yeah.
You mentioned that mostly it is found in children, and to rectify the deformity, it's not a one-time thing. So how long, maybe from statistics from those you've dealt with, how long can it take to rectify this?
Okay, it depends with the severity. So you find some are just mild clubfoot. 1, 2, 3 visits to the hospital and we are good to go. But some you find as much as 6 visits, and or even more.
And you find that people sometimes are not very aware of such information. And even at this era, we have people who are giving birth to children back at home. And in our society, I've heard once or twice somebody has a child that is deformed or have certain condition, and they fear their child is disabled, and they hide this child. So is there a certain stage when a child has grown up to, without this getting rectified, that you can get and it cannot be rectified?
I think I have seen people being rectified even at the age of 15 years. Yeah.
So there isn't an age limit?
No, it can be rectified. I've seen someone being rectified at the age of 15 years. And he's walking. You know, that one can prevent you from walking. You know, see, I think you have seen them even here in town. They have even the shoes facing each other, but they can walk, but stepping with these, we call it the lateral side of the leg. So I think there are some doctors who do it. They rectify even at that 15. See, that one is still a child.
Most of us have not seen a child with such a deformity, but now when you mentioned that, we can relate. So mostly you'll find them walking like they are walking with the side of their feet. That's awesome. Another of this condition that are there some of other conditions that an orthopedic has to deal with in children?
There are so many. Actually, we cannot exhaust the list today. You have something like the knock knees. This is where you find that the knees are knocking each other. They are touching each other, but the ankle, when standing, the ankle is apart. The knees are touching, but the ankle is apart.
That is a little bit common.
It's very common.
And what might be the cause for this?
Sometimes genetic.
Sometimes it is genetic.
It is genetic. You might find out someone telling you, my grandmother was like this, my uncle was like this, and it's also congenital. You find some kids are just born like that.
And
some kind of, they are lacking something like, finds calcium. Some kids are lacking calcium. So once you do the calcium tests, it's not a must that someone has knock knees and the calcium tests are not okay. But most of these, once you follow up, you find that the calcium levels are not fine, and something we call the ALPs, they cause the deformities, mostly in children.
The
ALP, alkaline phosphate levels.
And we find a lot of adults, people who are not children, with this condition. Is it also a condition that a deformity that can only be rectified in childhood? In adulthood, not just in adulthood, even in children, there are those cases that a surgeon has to step in. You don't achieve, you know, it depends with how you manage it. There are some people who use plaster to manage the condition. Some use splinting, and splinting is of many kinds. Someone may decide to use something we call a mermaid splint. Like we have something we call the Orion splints. We have something we call the Carfors. So it depends with how you manage it. You know, every person with his or her own way, but the results will still be the same. So you find that in some of these children, it resists the methods of treatment you give. So the surgeon has to step in. So it's not only in adulthood that you have to do the surgery, even in children. So there are those that we refer for surgery. Another condition that is closely related with that one is bow-leggedness.
So that one, you find that in between the knees and the ankle, there's that space. In a way that you can even, when the child is standing, you can throw a ball and it passes through. So that one, we also, the same method we treat the knock knees is the same method you use to treat the bow legs. It's only that you rectify a bit.
And you mentioned that some of these could be brought about by lacking certain minerals in the body, like calcium.
Yeah.
So can the right diet, help in solving these conditions?
So it depends with what you give the children. Yeah.
And
we normally say give them calcium-related foods. Yeah.
It's going to help with...
It helps, but mostly we give them the vitamin D3 injectables. We give them calcium supplements. Yeah, and they're good to go. Yeah.
With the bow-leggedness in the community, you hear people saying that it's because this child alianza kubebwa mapema.
Yeah, it happens. Yeah.
That can be an actual cause for this.
Yeah. You know, that is acquired. It's something that you acquire. But is that thing, again, it's genetic. As it not genetic, it's, how do I say, it's congenital. He was born with it. But is this other one that you acquire from? Yeah. Like that one, yeah, kubebo mapema, it happens.
So it is true. What you're saying about toto mapema.
Yeah. And the baby carriers also. You see, the way you carry your child, especially wale ubeba sana with that thing, you spread the legs to the sides. So unapanua mguu ya mtoto. So it happens. Yeah.
And is there a chance that these conditions can, the bow-leggedness and knock-knees, is there a chance that they can disappear on their own?
Yeah. Yeah. You find out that some of them, you discover them as early as even 6 months. Like for my case, at times, if they're not severe, I give them time. Yeah. You find that by the time mtoto anaanza kutembea, you don't find them. Ama tena mtoto anatembea mapema, you find them. Yeah. Akisha stabilize kutembea, unazikosa. Yeah. So it's not always that you have to rush to treat them. It's sometimes you even give them time, they disappear by themselves. But it comes to a certain stage now that mtoto akitembea, even at a distance, you can notice. Then that is when you come in. So at times, they walk into the facility, you just give them some kind of, you talk to the parent. Yeah, mnamwambia, you just do this and this, give them time, and then after some period, walk into the facility, we see whether they are there. And some come with...
when it has
with no deformity. Yeah.
And there is this other thing that you said, ati mtoto alitembea mapema. Is that in any way going to lead to some of these conditions?
Yeah, I have already explained that. At the age of 9 months, unapatanga kuna watoto 9, 10, wengine wameanza kutembea. So
and normally akidi suppose mtoto anafaa
at least 1 year. Yeah. So wengine hutembea at the age of 9 months. And even up to 1.2, the child is still not ready kutembea. So unapatanga wanazidevelop. Yeah.
And there is something else that could also be confused for bow-leggedness.
Yeah.
It is another condition, but somebody will appear to have that. But for it to get cured, you have to treat this disease, blount disease.
That one is actually, when it comes to blount disease, actually, we as the rehabilitative team, it's something that probably will not help as much. It's beyond bow legs. Yeah.
And even before we move from that, somebody might be wondering, what is this blount disease?
That one, the bone tends to bow more, and they are very weak. Yeah. So that one is a developed form of bow leg. It's not a bow leg. Yeah. And most of them confuse them with bow legs. Yeah. So that one, it normally doesn't work with splinting. So most of them work with the surgeons. Yeah.
So it's only surgery that can help with dealing with that.
It works.
So for people with who are bow-legged and maybe people who are struggling with knock-knees, sometimes people are advised to do certain exercises. And is any sort of exercise able to rectify these without the intervention of an orthopedic?
It's not easy. Yeah. You find that some of these bones are they are a bit rigid, so I don't think the exercise will do very much, but maybe some part of it. Yeah.
And what are some of these exercises that maybe if complemented with the works of an orthopedic can help in rectifying the condition?
The condition, the bow legs and the knock knees. Mostly they deal with the occupational therapists. Yeah. There's how they manage them. Yeah. But still, you still find them needing splints. Yeah.
That is okay. And you mentioned almost in every other condition, any other deformity we've talked about, you have talked about surgery, that at some point somebody will need services of an orthopedic surgeon. So in these surgeries, we are rectifying the muscles or the bones. The bones. Yeah. And are there some complications that could come with this?
Yeah, nerve damage at some point. You find swellings. Yeah, you may find infection. Yeah.
And when you talk about nerve damage, somebody might not exactly get what is nerve damage.
It's where you find that nerve has been touched. So it doesn't normally work the way it's supposed to work. Like if it's supposed to supply blood, you find that it doesn't supply that blood. So you find if it's supposed to take blood to a certain part, then that part will not get that blood. Yeah. Then there's that injury that was done somewhere. And some of them, you find them even with shortening. Something was done to rectify maybe the bow leg, but the outcome unapata mtu akona shortening ya mguu. Yeah. Maybe if the bone didn't fit well.
And these are things that you can help manage because they're only a side effects of treatment procedure.
When it comes to shortening now, it's another process. Yeah. You either give an insole if it's a small shortening, but if it's a big deviation, that is where you put a shoe raise. Yeah. You get a shoe and then you put a raising. If the shortening was 2 inches, you raise the shoe 2 inches. That lower side, so that zitoshane. Yeah.
Oh, thank you so much for that. We are going to be taking a short break here at Medicamp. Stay right where you are because there's still more that you're going to be learning from this episode. See you.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. Oho nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahich Hotel, Murang'a Town, kũng'ethana na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Road Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo Gĩthũngũri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakĩma Moreline House. Na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 0725 8641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku.
We are putting certainty in their future so you can have a peaceful life. Exploring emerging opportunities so you can explore life. Covering your health so you can share your well-being with others. Taking care of your investments so you can enjoy the fruits of your wise decisions. With Britam, we are assured of over 55 years experience in life insurance, health insurance, general insurance, investments, and retirement solutions. Britam, with you every step of the way.
Thank you so much for staying tuned. We are back again in the second segment of this show. Today we are talking about orthopedics, and Cairo here told us it is all about bones. Daktari, sometimes we have people who don't have parts of their body, they were amputated.
Yeah.
What are some of these things that would cause somebody to come to an orthopedic surgeon and part of their body has to be removed?
First of all is RTA. When you talk of RTA is road traffic accidents, all about accidents. So you find that some parts have to be removed. maybe someone had a very bad fracture, a very bad cut that could not be treated. So unapata wana either way the part of the leg or the part of the hand has to be removed. Then some diseases like cancer, diabetes, especially diabetes, it causes a lot of amputations. Yeah. And you also still find that some machines, like those people who are using the chaff cutters for cutting napier grass, huwa inaenda na mikono sana. And some carpenters, there are those machines that, there are so many machines that may make you amputated. Kuna wengine unapata, someone tells you they had trauma. Maybe he fell from a tree. I've seen one. He fell from a tree. And then he got some kind of a fracture that could not work either way, with the plaster or with the fixations. So it had to be amputated. Yeah.
Sometimes when amputation happens, like maybe I've lost my leg, it becomes a little bit difficult. Are there things that you could do? Are there some, they call them devices that you could help these people with to survive after amputation?
Yeah. We have the prosthetic legs. Yeah, there's prosthetic limbs. Yeah. They're the best. And prosthetic arms. You find, especially for the arms, you find there are those manual, there are those electrical. But for the leg, mostly you find the manual. It can be an above knee amputation. It can be a below knee amputation. It can be something we call the same amputation. So it can occur anywhere. Through knee amputation, through hip amputation. So ukitengeneza that prosthesis, now it has to guide you. Yeah. So it doesn't mean that because someone has an amputation unaweza tu weka mguu yoyote. It has to go with the kind of amputation. Yeah.
That is insightful. And also we have this other condition called calcaneal spur.
Calcaneal spur.
Calcaneal spur.
Yeah. Hiyo unapatanga ni a growth that occurs at the foot. Yeah. So mostly in sana ladies, high heeled shoes, those pointed shoes. Yeah. So I don't know whether you could be affected. Yeah, they look good. They make you look good, but at one point in life, it may cause some effects. Yeah. You see what happens. See, inainua, and then you find that the toes are directed at one point, at that pointed tip. So unapatanga weight haijakuwa distributed vizuri. Yeah. And also the heel parts, those people who live in the heel parts, and those who walk a lot. Ukiuliza mtu anafanya kazi gani, it's maybe anakwambia I'm a teacher, anashindanga amesimama sana. I'm a business person, natembea sana. I'm a weight. Yeah, it's good to work on weight. It causes, unapeleka hiyo mzigo wote wapi? Kwa mguu, kwa the foot. So probably inashindwa kubeba hiyo weight. You develop that thing. Yeah, and it's very painful.
It is painful. Very painful.
Ina growing kama kasindano. So mahali inadunga, it makes a kakidonda. It makes a something like a wound. Yeah. And it's something like, what do we call it? It's an inflammation. It causes an inflammation. Yeah.
And how do you help people with that deformity when they develop that? How do you help that in terms of treatment?
That one you give, they are normally given the injectables there at the foot. And then there's that insole to relieve. Yeah.
By injectable, you mean?
An injection is done there. Exactly at that point. Yeah. So you do an x-ray, then the person will locate where the spur is, and then they'll inject. They inject with steroids. Yeah. And then now the insoles. The insoles work the best. They're the silicone ones, and they're the ones that we modify. Yeah.
So somebody is asking, we are here, we said orthopedics, ni about bones, ni mifupa. Somebody is saying they have back pain. And our mothers say, yeah. Your back is hurting and all that. Do you help with such conditions?
Yeah. So they normally go down with treatments. So for one, you must know the reason. So it could be a back pain due to muscle spasms. kuna mtu unaangalia unaona at this age this person is very young. It could be due to some osteophytes, yeah. And again it could be out of trauma. So the first question unauliza mtu uligongwa, ulianguka. And it can also come as a result of the family planning method someone is using, especially for the women, ama infection. At that point unaniambia maybe the mothers are saying our mothers are saying wanaumwa. Sasa hiyo si unajua probably there is something to do with osteoarthritis. Yeah.
And well, at it, let me just draw it in because we are talking about back pain. We have ladies who experience back pains during menses, during
it
menstrual
happens.
periods.
Yeah, it happens. Yeah.
Can that be helped by an orthopedic?
That one is a stage. You just manage using painkillers,
and then it just passes.
And then it just passes. But as for the other one now, like you find maybe there is that osteoarthritis, there are those drugs that are given. Yeah.
So sometimes when people are having these pains, maybe a part of their body is aching and it has to do with bones, or even somebody got injured in an accident or something. At times when they come to you, you talk about therapy. You're going to be aiding them with physical therapy.
Yeah.
Exactly what is this therapy? Is it massage? What is it? What is involved? Mtu ukimwambia utaenda physiotherapy, what should they expect?
Part of it could be massage. Then someone could manage maybe using some kind of machines like the TENS to relieve the pain. Someone would use ice, ice cube. Yeah, someone maybe would manage. And by the way, inaweza kuwa pia there is a slip of the disc. So unaona that one has to be detailed treatment. Yeah, it's not all about massage. Kuna mtu anaweza kuwa anaumwa and the pain maybe is so intense that huwezi manage kusugua. So you understand me? And at some point there are those things that we give them. They are the lumbar corsets. Yeah. It's like a mshipi, a strap. I don't know whether you know it. Like the one used by ladies to tummy trim. So that one has to come from the back end. Yeah. So at that point unapatanga mtu sasa anakuanga amefika ile sasa mwisho na kuumwa. So we normally use that one to relieve the pain. Yeah.
And that is the same that you sometimes find somebody
for the knee. When someone has osteoarthritis of the knee. Yeah.
And so we also talked about surgery. And sometimes people have bone fractures, like maybe you are in an accident and your bone has fractured. Is that something that you can help people with? Because you realize that sometimes people are living with a deformity that can actually be rectified if they come to you, but they don't know. So how do you help manage bone fractures?
Bone fractures can be managed through different ways. There's that one you can use a plaster. You just tie a plaster. You know the plaster. And then there's that one. It's beyond now that. And that one the surgeon has to come in for either way some tumors. Fixing. Yeah. So and others unapatanga the damage is intense. Yeah. Zingine unapata sasa mtu anakuwa ile deformed, atalive tu na hiyo deformity because something somewhere went wrong na it was not rectified well. Yeah. So like you find shortening of the leg. Aliwekwa chuma but some parts went missing. Yeah. So some parts of the bone, so it has to shorten. So that person has to live with that shortness. Yeah.
You mentioned the kuwekwa chuma. A lot of people don't understand what would lead you to kuwekwa that chuma, and do you have to do with it for life?
Kuna zingine unawekwa you live with it, na zingine unawekwa na unatolewa. Yeah. Na hiyo chuma, by the time mtu anawekwa chuma, unapatanga it's a fracture that is beyond now plastering. Yeah. It's either way, it's completely displaced. A fracture is when a part of the bone is broken. It's either partial or complete. So if that bone was broken in a way that it cannot, you do some reductions before you funga that plaster. So if you find that maybe the way that maybe ilichomoka and in a way that even if some reductions were done, it won't help. So that is when the surgeon steps in. Yeah.
to put that
to put that on.
So you said there is a condition that you could be treating and unaweza kaa nayo for life, and there is another one in unaweza tolewa. What exactly would cause the division of when you will have to live with it and when you will have to get it removed with time?
Okay, some are just mild, then some have some intense. Yeah,
They are severe.
They are severe. Yeah.
So when it is severe, you have to do with it. So we are also talking about bones, something else that could affect the bones. We hear of bone cancer. So with other cancers, we know that it is excessive growth of some cells. So what exactly is happening by the time somebody is being told they have bone cancer?
So you find that, that the cells are damaging that bone. Yeah.
They are affecting.
They are affecting that bone. So inaendanga ikikula hiyo mfupa. Yeah.
And so we understand that in medicine, you might find that one patient requires several specialists to cure what they are suffering from. So when somebody has bone cancer, is there need for an orthopedic surgeon or someone in the orthopedics field, and how do they help?
Yeah, to some point. Like the ones that have to be amputated, you have to come in. Yeah. So some lead to intense damage. Yeah.
And so a surgeon would need to help.
The surgeon will need to help. Yeah.
So that is okay. But,
of which some people dismiss that one. Maybe mtu anaona, I don't want to lose my part of the body. Like I don't have to lose, like I don't have to lose my part of the leg. So I would rather just live with it. Maybe go for radiotherapy, go for chemotherapy. And then you find that it has metastasized. Yeah. Yes, that one. Yeah. Now it moves to that other parts of the body. Yeah. And that is why you find that you get encouraged. If it has to be amputated, it will be amputated before it goes to a certain stage where it cannot be worked on. Yeah.
Thank you. So while we are still talking about this, is there a lifestyle or is there something that we can do for cases that are not accidents to avoid some of these pains, like maybe the back pain we were talking about, so that it's not, we don't have to come to the hospital or to the clinician or to you when this is something that you could have actually prevented with lifestyle?
Yeah, when it comes to back pains, mostly, you know how you are working, especially for the ladies. Hiyo kuinama, that bending too low to wash the clothes, to do the laundry, yeah, sometimes. And then the methods of family planning one is using. Some of them you find that the back has to ache. And yeah, there's so many things one can avoid. And the seats that we are using, yeah, you find the seats that we are using are not good. The positioning of the seat, unapata, you have to bend when seated, ama you have to at least a seat that will keep you upright. Yeah, that one is good. And some of these mattresses that maybe we're using in our homes, they are not good for our backs. Yeah. Unapata, you sleep in the middle, it has sunk. So that one you have maybe to wake up with your back hurting. Yeah.
Ikisink to
badilisha. Ama you get a good orthopedic mattress. Yeah. Ama just a firm mattress that does not have to sink. There are so many things with our lifestyle that makes our back. And then there's this other thing that brings the bad. And people may not be knowing. And you find that it has gone to an extent that it will bring damage. You find yourself being wheeled, being in a wheelchair for life. TB of the spine. Yeah, that one we had not talked about, but it is becoming so common nowadays. And you find people walking to facilities, just a normal X-ray is done, and maybe something was not found, and then this person goes. You find that now they cannot walk normally. Yeah, that one is another one that is affecting. Yeah.
So mostly it has to do with whatever you are doing. What is your posture? If you maintain
the TB of the spine,
not
no,
the
others.
The others when we talked about them collectively.
Ama trauma, ama maybe you ulijaribu kulift kitu and and something happened to your back. So at least even lifting heavy loads, you find people working in these industries, ama somewhere that is busy, you find them complaining of the backache. Maybe somewhere that throwing off those stones. You know, you're straining some muscles, and then there's these muscle spasms. It's just very common in young people. It has nothing to do with bones. It's just muscles that you find most of these young ladies are complaining of backaches, just their muscle spasms.
Also, I've talked about back pain and really kind of centered it with women. Is there any other reason for, because you realize also men complain a lot about back pain?
Men complain because of the work they do.
So for them it's easy.
It's very hard. You find someone who does soft jobs complaining of the backache. You find someone, either the job they're doing is a bit tedious, the way someone, like now you see this one, someone who is just limited in an office, amekaa tu kwa kiti, it can easily lead to that. It's not just about the hard job, but even this, it's that maybe mostly the ones that are used in the offices, if it just doesn't have that backrest, I don't know whether yours have that. There's that, you find it.
Like it should be a seat that will make you sit upright.
And then there's that backrest that is, you get that device.
So you're going to be working on that. Everybody that is watching us, everything that we are being told that you can actually do, you can actually rectify or minimize to not get these effects. So let's talk about our feeding habits. Is there a way that when you eat foods that are lacking certain diets, like let's say we are told calcium helps with bones. So if you're taking foods that are deficient in some of these supplements, is there any connection that you could be having problems with your back or with your bone structure because of what you're feeding on?
Not really.
That could be rare.
In most cases, you find that, especially to say like in lactating mothers, you see, there's that time you're told use jahe, use soy porridge. It's not mostly because of calcium.
It is because of every other nutrient.
Because of every other nutrients. And I don't think that you'll find people complaining of back pains because of the diet only.
For the first time, we are dealing with a condition that has little to do with what somebody is eating.
But you find people being advised take bone soap, especially after fractures. That healing period, you're told to take bone soap. It helps with quick healing. Bone soap. And nowadays I'm seeing people going for camel soap. I don't know how nutritious it is.
Maybe it's healthier and more nutritious. So I think we've been learning a lot on this episode because these are things that we kind of assume we
ignore.
And ignore, that is the word. And like when you're walking for long distances, we tend to think that maybe we are exercising, but maybe you're doing harm to yourself. You could find yourself having a flat foot or any other of the deformities that we've talked about. So doctor, as we're winding up, I'll give you an opportunity using this camera. Maybe there is something you want to educate people, and maybe there is people want to reach to you. Somebody who is struggling with this and they want to reach out with you. You can share your number with them.
Okay, and I would first advise the young mothers, once you have your child with you, it's good to check on the child. Because some of them bring them to the hospital when it's too late. Unapata mtu anasema, I saw it, but my grandmother told me that so-and-so was like that, and it rectified itself. So I would like to advise the young mothers, just be keen on your children as they are growing. And again, once you're giving the supplements in the hospitals, like the folic acid tablets, they are very good. You know, once you don't take them, there's something you lack iron. So you find that once the baby is born, there's that condition. We'll talk about it next time, the spina bifida. You find that they develop such conditions, and there are so many things. It's good even also to take the calcium supplements, if possible, when one is expectant. You reduce later there are some things you prevent later on. Yeah.
That could actually occur in the future if you
in future. It's good to take precautions earlier, especially for the folic acid. Yeah, it's good to take precautions earlier enough. Yeah. And if someone they are not good to take. They are sometimes they are not easy to take. They cause some things, like when one is pregnant, you find some women saying I cannot take it. Then there's other things to use like spinach and lean meat. It's it's done, but it's called like that. Yeah, yeah. Huh?
Is it liver?
The liver, yes, yes. It has a lot of iron in it. Yeah.
That is take home for young mothers and pregnant
because
women.
Now I think we deal mostly with these young lactating mothers with those young kids, bringing them in and out. Yeah, and also our fellow health workers. Yeah, because some of these kids you find them alipita kwa kilo lakini hakuonekana hiyo. Alipita pale MCH with the injections, and if she didn't air out her issues akasema hapa kuna shida, so that maybe the nurse taking care of that can forward to the next person. I think that is now where we miss the step. Like now in my facility where I work, I think I link to the nutritionists. Once they come here, I normally tell them once they come here that is for weighing, they normally use the weighing machine at the nutrition facility. Once they are out from MCH, I normally tell them, make sure you check on that child, especially on the flat feet, because they don't know. Unapata mtoto tumiguu tumeinama. So that child hata kusimama wakati mwingine inakuwa ni issue. Unajua ana hiyo balance. Yeah. So unapata wanachelewa hata kutembea. So and I think we are doing well with that. So I think even our fellow health workers, sometimes it's good to, even once you spot one walking huko kwa road, tell them this is not, it's something that can be, it's not normal. They say it's normal. Just go to the hospital and you have your child treated. At least you will avoid later on deformities. I think you do not want to see an old person with no knee. Yeah, sure. Yeah, it's a terrible state. At that old age.
So that's a call to health professionals to
at
work
least
together to
work
help
when
to address some of these cases.
Yeah.
So in case somebody wants to reach out to you, because like you're saying, we'll just meet people working out there with these conditions. They don't know where to go to. They think they are normal. So in case someone wants to reach out to you, how do they do that?
Can I give my contact?
Yes, if that's okay with you.
My number is 0710 610 571. Yeah, and I'm located mostly in Murang'a town. Yeah, but I have other outlets. So maybe someone in Embu, I have outlets. So it's easy to reach me. Once someone contacts me, it's easy to reach me.
Thank you so much for making time for us and for teaching us all of these things. These are things that we assume or we ignore them and say they are normal and they could actually be dealt with from an early age. So that will be all from Medi Camp tonight. Thank you so much for making your time to tune in and to learn together. Remember what we always say, that your health is your wealth. See you on our next episode.
Mediation nĩ kuuga atĩa? Mediation nĩ gwetha kĩhonia kũrĩ arĩa makururanĩtio thĩinĩ wa ngũrani. Methaga mũndũ ũngĩ wa kũmatuithania ũrĩa ũĩkaine ta mediator. Mediator ũyũ nĩ mũndũ ũtaregemera mwena ona ũrĩkũ, ũhĩgĩrĩire na gũteithĩrĩria arĩa marĩ na ngũrani gũkinyanĩria kĩhonia. Na nĩkĩo we mũikari wa ũthaya na matũũra marĩa marigicĩirie na gĩtĩo kĩnene ũranyita ũgeni thĩinĩ wa gũtaũkĩrwo makĩria nĩ watho na makĩria ũrĩa andũ mangĩtuithania cira nja wa igoti nĩ tarĩki 16 mweri wa Wagatano mwaka ũyũ tũrĩ kwambĩrĩria thaa 2 cia rũcinĩ. Maya mothe makĩanĩkire thĩinĩ wa othaya NGCDF Hall. Thĩmu nĩ ũrĩa kĩhoto gĩgĩkinyanĩrio hamwe na ũkũria kũgerera njĩra ya ũiguithanio. Ndũkanahĩtũke nĩ maya, inyuothe mũrĩ anyiti ũgeni.
The Nyeri County Annual Tourism and Cultural Festival 2024, initially slated for 17th to 18th May 2024, has been postponed to 21st and 22nd June 2024 due to the heightened